Again, thank you for coming to this morning health talks on artificial intelligence and big data in health. And as I said, I'm George Megas from the National Documentation Center, and we are responsible for supporting you in Horizon 2020, supporting you to find collaborations with the Enterprise Europe Network, and of course, we are coordinators of the EIT Health HUB in Greece. And we're going to tell you a little bit of our story from 2017, where we became the EIT Health HUB here in Greece. We have supported more than 60 startups to apply to EIT Health acceleration programs, and 12 of those startups have been funded or accepted in some supported programs of EIT Health. Here on the image, you can see Thanasis Pathis from Synosis Therapeutics winning the first prize in the biotech category of the EIT Health Catapult Awards. I guess the most prestigious, I think it's the most prestigious awards in EIT Health, and it's regarding very innovative startups in biotech, medtech, and digital health. Here are some other startups and scale-ups that we supported to receive funding from EIT Health competitions and awards like Head Start, Catapult, InnoStars, and other competitions and awards. This year we have with us, today we have with us Vasilia Hadjistegiou from Booking Clinic. Booking Clinic was 2020's winner of the Head Start awards from Greece, specifically in the COVID-19 cohort, and she's going to tell us a little bit about their journey and also how they won the competition and maybe some hints and tips, but mostly focus on what the Greek startups need from the public sector in order to go to the digital era even further. Also, we have supported more than 150 students applying in health and education programs. We started focusing also on students in 2018. And this year we supported more than 100 students applying for the Hello AI REIS program, and 65 students from Greece were accepted, ranking us among the highest attendees of the program in Europe, alongside with Poland. We thank also our manager Beata for this for the support for this to happen. Continuing, we deal with innovation management. We try to stay up in the trends that are going to. Just a second. We take advice from graphs and hype cycles like the ones from Gartner. We can see here that on the left side of the graph, on the innovation trigger, we'll see the most hyped technologies that are going to be on the scene for the next years to come. And on the right side, we can see those that we believe that are already able to go to the market. We should take advice also of such graphs and analysis from institutes like Gartner. And in 2019, Gartner asked the strategy officers in a study that they conducted in various American healthcare providers to rate the most important trends in the sector based on 3 criteria: impact, how much its trend will affect them over the next 12 months, velocity, how quickly the impact of each trend will be felt by the healthcare systems, and their organizational readiness, how confident they are about their organization's ability to cope with each trend, how they believe they can deal with the trends. So they believe, these healthcare strategists, that their system is less ready for the consolidation of the healthcare system in the USA, the increase in the consolidation of the healthcare system. And when we say consolidation, we're talking about mergers, acquisitions, affiliation agreements, and facility closures by combining former competitors in the market and making them actually work together. There is vertical consolidation when a hospital, for example, purchases an outpatient center, or a health plan company merges with the hospital system. It's justified usually by saying that it's going to make better the system and make it easier to coordinate and improve the healthcare quality. And there's also horizontal consolidation, but I won't go into details. They believe also that the higher impact will come from more actionable big data, data that you can actually visualize and have decision makers make easier decisions and actions. And the strategists believe also that the fastest coming trends are the new payment models based on value, not on quantity, for example. And so we're calling them value-based payment models. And the preventative care that they should be focused on. And they believe that those 2 trends will actually they will have to deal with those trends in, let's say, early 2020. Although COVID-19 came, I don't know what happened there, but these trends coming. And of course, the greatest opportunity or threat is the need for, let's say, what we heard as Health 4.0, like having a patient-centered care. We're calling it also tailored messaging. So continuing, I will show you also some trends. You see companies like FibriCheck, which is funded by EIT Health, and FibriCheck, I used it myself actually. Tells you if you have if you have atrial fibrillation by just putting your finger on the camera, not even a specific sensor. We can see also StithoMe, like other companies we've seen also in Medical Valley in Erlangen or Israel in Tel Aviv, that you can also help you can self-examine, you can examine yourself without leaving your home, and the results go directly to your doctor. I think that we saw these latest days with COVID-19 that this is something that it's going to be also helping us improve our lives and our medical examinations. We've also seen AI Doc, startup that supports, startup from Israel actually, that supports radiologists to identify issues in MRIs or CT scans like brain hematomas, and other trends could be printed surgical implants, genetic medicine, and precision medicine. Here we can see that the team of EIT Health Innostars visiting the ARC center in Siba Hospital, and also we went on the room that the radiologist is using the AI Doc to help him identify and prioritize patients with high risk of having a stroke or other issues. What do the major companies do? We see that Amazon has created as a pilot first for their own employees the
Here's what I found online.
Okay, now that we're talking about technology, Bixby replied to my voice. Sorry for that. And we also said we were saying about Amazon creating the Amazon Care, and also, excuse me. Okay, sorry. We're seeing Amazon Care, and Amazon also acquired PillPack, an online pharmacy. So they can, you can actually, if you're actually an Amazon's employee, you can receive a diagnosis from your doctor and also receive the medicine in your doorstep. Philips is focusing somewhere else in seamless radiology and Internet of Medical Things. And Google acquired Fitbit, and of course collaborated with Ascension Hospital. So it's all about data for Google, and we'll talk about later with Dr. Gal Neumann about that, and Liron friend from Israel. Continuing, I will give you a few words about what we do also here in the National Innovation Center. We are coordinators of the Greek node of the biggest network for supporting internationalization of SMEs. It's the Enterprise Europe Network. We are 3,000 consultants in 600 regions in 60 countries. And we can support you find partners abroad, mainly by using our platform, where you can upload your own profile, searching for business collaborations or technological collaborations, or partners to participate in together in research consortia. And also we organize brokerage events in the framework of big fairs like Αναδυόμενες, Anuga, Posidonia here in Greece, or Medica. And here are some examples of profiles on the system. You can contact us and we'll help you create a profile. Also, we are in the Enterprise Europe Network is not only in Europe, it's in Singapore, Israel, and elsewhere. We are also national contact points for Horizon 2020, which is going to be replaced by Horizon Europe. And of course, we will support you and do pre-proposal check for your proposals. Horizon 2020 had 80 billions for the last years, and it had 3 pillars. Excellent science, that included Marie Curie and other programs you might be aware of. Industrial leadership pillar with ICT, nano, biotechnology, etc. And of course, the SME instrument there, and now Accelerator. And the societal challenges with health, smart energy, and other. Now, the new pillars of Horizon 2020, they have changed a bit, but pillar number 1 remains almost the same, including European Research Council and the Marie Curie actions. Pillar number 2 is different and it includes clusters. first cluster is the health cluster. We already have the work program for this in a draft version. The second cluster is about culture, creativity, and inclusive society. The fourth cluster is civil security for society. The fifth cluster that we are National Contact Points for is digital industry and space. Fifth, climate, energy, and mobility, and sixth, food, bioeconomy, natural resources, agriculture, and environment. And on pillar number 3, we can see the European Innovation Council with its Accelerator program. It's also suitable for risky startups. The European Innovation Ecosystems, which is a new program, and the European Institute of Innovation and Technology, EIT, with its knowledge innovation communities, including EIT Health, of course. It's important that we mention also the European Innovation Council that could help complement also the funding opportunities from EIT Health. After you receive your funding from EIT Health and support to do a proof of concept, then you can also try to apply to the EIT Health, to the EIC Accelerator. The EIC Accelerator provides funding to innovative SMEs that have the potential to go abroad and they're high risk. It's bottom up. Any idea can be applied if you are on a technology readiness level of 6. 0 is just having an idea. 10 is you're already in the market. 6 means that you're close to a pilot. And you can request both either a grant up to 2.5 million with a funding rate of 70%, or you can request up to 15 million in equity funding. The proposal is 30 pages and 10 additional pages if you're requesting equity funding. And if you're requesting equity funding, which the fund will be the European Commission's fund, and they can also only acquire up to 25% of your company and will give you 15 million, you have to have a technology readiness level of above 8. So if you are till 6, you go only for the grant. If you are above 8, you can try blended or grant and equity. Here you can see us starting to meet to understand what actually NVIDIA AI is doing. We went to Tel Aviv and we listened to Liron, that you're going to listen also after me. And of course, we had some Mythos beer in Israel. It was a highlight for me, I'm kidding. And those are our speakers. Monica Toth, that you listened before from EIT Health. Liron French-Sadun, Director of Healthcare at NVIDIA Israel. Dr. Gal Neumann-Wexler, Vice President of Business Development Developers, Data Science Group Israel. Dr. Vasilia Hadjisteriou from Booking Clinic, and an ophthalmology resident at the Center of Ophthalmologique de Rive, Geneva. Dr. Charalambos Karanikas, a Professor of Computer Science in the University of Thessaly, and Dr. Dafoulas Georgios, Clinical Research Fellow, Faculty of Medicine, University of Thessaly. Dr. Spiros Arsenis, Manager of the NBG SEEDS Accelerator of the National Bank of Greece, and me. And thank you. Let's see what's happening and what the pioneers are doing. And sorry if it took too long.